Hello and welcome Eastern Michigan University nursing students. My name is Frank Schaller and I am faculty here at EMU. I'm going to walk you guys through the Capstone Population Focused Practice Experience. And you might be wondering, what do I need to know and do to be successful? Let's jump right in here. So we, the faculty of the School of Nursing here at Eastern Michigan University, we believe that student development in the professional role is enhanced through a precepted one-on-one concentrated practice experience. The capstone experience allows the student to apply concepts and content from previous coursework to an actual practice experience. The student's completion of a meaningful project can positively contribute to the preceptor's workplace and to the population served. Students generally provide really good feedback after this experience. Please see the capstone link in the YouTube video description below. Additionally, please click on the link below or the capstone directions for important information that you'll need to know and upload into Project Concert 4 to 6 months prior to taking Nursing 483 L4 or the Capstone Population Focused Practicum. Please remember, registering for this course is by department permission only. Thinking about eligibility for the capstone. So it includes a few different things. Number one, successful completion of the following classes with a final grade of a C or better. So we have Nursing 300W, we have 221, 265, 365W, 374, 453, 465, and then 2 courses in 479 special topics. Additionally, all health required documents also need to be uploaded into Project Concert. And to access Project Concert, it's really easy. Just go to emich.edu/nursing, scroll down to the bottom of the page, and you'll see on the right-hand side there is a link for Project Concert. Thinking about some required documents. So prior to registering for the capstone, the following items need to be uploaded into Project Concert. If you click on the link below, you'll see the required health documents that are needed. So, for example, you must show titer results and the dates drawn or the dates the vaccines were given for measles, mumps, rubella, rubeola, varicella, and hepatitis B. Keep in mind, having a history of one of these diseases does not provide proof of immunity. Also, a urine drug screen will need to be performed, and this is generally a 10-panel screen and can be done at any office or site that does drug testing. You can consider using Concentra or a Michigan Urgent Care for your needs. Some more required documents. So, current documentation of freedom from TB, this is required. So what this means is a negative TB skin test within 1 year, or a current negative chest x-ray, or a negative symptoms checklist by a qualified healthcare provider. You should also show proof of having a current BLS or CPR card. Preceptors. Thinking about preceptor-specific information. So when selecting a preceptor, there are a few things you need to consider. And again, always refer to your capstone handbook or the link below for more details on this. So the preceptor has a minimum educational preparation at the BSN level. The preceptor has a current unrestricted RN license in the state the precepting is to occur. And there's a minimum of 1 year of BSN clinical experience as a licensed RN. Finally, a minimum of 6 months work experience in the present setting will be required. Also, the preceptor has to have voluntary acceptance of preceptor roles and responsibilities, and clinical competence is supportive of the ability to preceptor students. You guys want a good preceptor. Unfortunately, you may not precept on a unit that you are currently employed on. I'm so sorry for the inconvenience, but that is one of the requirements. Thinking about the student-provided information, So the student will provide to EMU School of Nursing the signed preceptor agreement form, which includes the preceptor name and title, the agency address and phone number, the office manager's name and contact information, the area and unit the preceptor works on, and start and end date of the class and the shift the preceptorship will be on. The student will then contact the RN to BSN coordinator when all health documents and this preceptor agreement form when they are uploaded into Project Concert. The RN to BSN coordinator will then initiate the placement request into ACEMAP if indicated, and will initiate an affiliation agreement with the agency if the indicated prior to the start of the capstone experience. See the preceptor agreement forms link below this YouTube video. Going a little bit further into what the student needs to do, the student will provide the preceptor with a copy of the syllabus and the capstone handbook, and you'll see that link below. And the student will complete ACEMAP requirements if at an agency that participates with ACEMAP. And then, in addition to all of the agency orientation competencies and or modules specific to that agency. Thinking about preceptor information, again, you may not precept on the unit that you work. And if you are wanting to precept at the following agencies, so we have Michigan Medicine, Beaumont Royal Oak, Children's, DMC, the clinical placement coordinators at these 3 sites will select the preceptor for you. Just send the preceptor agreement form with your name, student ID and email address, dates you will be taking the course, and the shift desired. The RN to BSN coordinator will forward the request via ACEMAP to the site and course and shift desired. The RN to BSN coordinator will forward the request via ACEMAP to the site, and they'll help you find a preceptor. Preceptor eligibility. Thinking a little bit about eligibility for the capstone. So in selecting a preceptor, please keep in mind that the outcome is to develop a project that will help a population of patients. Frequently, students will ask their nurse educator, clinical nurse specialist, or clinical nurse leader. There's also case manager, wound care nurse, hospice nurse, injury prevention nurse, or infection control nurse, a school nurse, or a parish nurse could be chosen. Your course faculty will be able to help you develop and follow through with an identified topic once the preceptor is selected. 50 hours with the preceptor is required, 50, which includes 8 to 10 hours utilized doing research for the project. If you see pages 3 and 4 in the capstone handbook, link is below, this will show a more thorough explanation of the project you may want to consider. Review time! So just some other details. Let's take a moment and quickly review a few other key details. So if there's additional information needed, the RN to BSN coordinator will be in contact with you. Additionally, preceptor agreement forms and health required documents should be submitted 4 to 6 months prior to taking Nursing 483L4. The affiliation agreements, they can take 2 months to 12 months to process, depending on the agency. Out-of-state agencies may take longer. The sooner you have the preceptor agreement form uploaded, the sooner the affiliation agreement can get started. The sooner, the better. Well, that's it for now. Please do not hesitate to reach out to the Eastern Michigan University School of Nursing if you have any questions, comments, or concerns. Have a wonderful day.